Hello, and welcome to the Real Ram Fam. On my Hello, and welcome to the Real Ram Fam. On my channel, I intend to provide you with a safe platform to discuss the intersections of your entire being, to be able to be comfortable in your own skin, in mission or position. There is no one like you, and we all have a purpose and message. I, for one, am a black woman, mother of four, a military veteran, and a wife, and a social worker, just to name a few. From my channel, I hope that you learn more about military families and social workers. 3 of the social work values are my aim in each video: importance of human relationships, dignity and worth of the person, and social justice. No matter what you initially think when you hear social worker, there is more to the profession. Trust me. Stay locked in by subscribing to the channel, and be sure that you hit that notifications bell so you don't miss any new uploads. Without further ado, on to today's episode. So what's going on, Ram Fam? I hope y'all having a good day. There's my little ticker to remind y'all who provided the music that you heard in my intro today. So happy Social Workers Month and happy International Women's Month, Taryn.
Thanks. It's nice to be here.
Thank you. Thank you. So today I have with me another fellow social worker and woman to talk with y'all today. Today we're going to talk to y'all about another career path that you have in the social work field. And take it away, Miss Taryn Jones. Let the people know where you are and what is the name of your field of study.
So I am currently a general medicine social worker. So I work at a community health organization right now. And I partner with doctors and nurses to help clients get needed services, whether that's medication that they can afford or housing. It's just kind of a general, it's very open. I work a lot with different providers and just try and find resources for clients. So I really enjoy doing that. I work in Kansas City, Missouri. So I'm from the Kansas City area.
KC-Mo.
Yes.
Okay. And so how long have you been doing that general medicine?
I have been doing general medicine. So I've been a social work healthcare worker for a year, and I was doing pediatrics up until about January, and I switched to general medicine at that point. It's the same agency. I just switched positions within the agency because they needed someone to do general medicine, which I've really enjoyed. I've worked a lot with kids in the past in my work, and so it was nice to get an opportunity to work with adults, and so I'm really enjoying that so far.
Cool. Thank you for that, because I know medical social work has got to be taxing. So explain to the people, what exactly do medical social workers do? And are all of them inside of hospitals?
Definitely not all inside a hospital. So medical social work can include a lot of things. I know I have some medical social work friends that have worked just in like doctors' offices. There's emergency rooms. There's behavioral health units within the hospital, and then there's healthcare clinics, which is where I am. I'm at a healthcare clinic, and so we're just open, your typical 8 to 5 during the day, and we don't provide, any emergency services. And so a typical day for me is I'm upstairs and I'll get called down. So like if we have clients who need resources while they're there, I'll get called down to help with that. And I'll also work on some more complicated issues. Like I currently have a client who is experienced some elder abuse and, has some memory loss. And so we're trying to find a way to get her into a like long-term care facility where she can be, you know, better watched. And so it's complicated issues like that too. I do a little bit of the kind of case management type stuff where I'm doing resources and things like that are more one-time things for clients. And then I'm kind of working with other clients that have some higher needs like that.
Okay, so since you're in a clinic, since you're in a clinic and, you know, there's someone's there for a broken arm, you know, and then you find out that it's otherwise, then that's when you kick in and take over, or how would that work?
Yeah. So basically, you know, if someone comes in for their medical appointment, or we actually do dental on site too. If someone comes in for a medical appointment or a dental appointment, we will, you know, if the providers will ask questions, and if they feel like a patient has a need, like the patient says, oh, you know, I've just like had a really hard time getting to these appointments. Like maybe the person has canceled 5 or 6 times. And, you know, when they finally come in, they're like, oh, I've had a really difficult time, you know, getting to this appointment. That's where I would step in and look to help them with like transportation resources. And, you know, maybe that's if they have Medicaid, maybe that's Medicaid transportation, or getting them assisted with like bus fare, or, you know, we have cab vouchers for some situations where like a bus isn't around where they are, or, you know, to get to a bus station to get further to our place. But it's things like that are in the clinic. They'll call me down and we'll work on problem solve those issues together. And also they do a yearly screening on all of our patients for social determinants like that. And so they'll do that screening, and if they score high on that screening, they'll refer them to us, and we'll reach out to the patient to figure out how we can help get them the needed resources.
Yeah. And thanks for clarifying that, because, you know, a broken arm is actually the ER, not a clinic.
Yeah, we're just kind of a health clinic, so we just kind of do routine care.
Yeah. So one of the pieces of a job description from medical social worker is educating patients and families about illnesses and treatment plans. Can you go on a little bit more on that?
Yeah, so we will educate both clients and families. So like, for example, with this elder abuse case that I had, I did try and do a lot of education with that around the patient, like helping them because they have memory loss, and, you know, the family won't come in with them, so they'll end up alone. And we'll have to, you know, try and explain to the patient, like kind of what's going on. And I have another case that was difficult, who she was very good about advocating for herself, which was amazing. But she would come in, you know, every day to the clinic trying to get assistance, and she'd only talk to this one doctor. And so I had to, you know, call her and be like, you know, it's really great that you're advocating for yourself. Like, I'm so proud of you for doing that, but we just need to find a different way to do this, because she was at the point where like doctors wouldn't work with her. Like, she was getting referred to different specialists, and the office would cancel her as the patient because she just had she would come in like demanding things that weren't necessarily appropriate. And so we kind of had to have a conversation of, hey, like, you know, I think it's really great that you're able to advocate yourself, and you know what's going on with your medical care, and you want to get the best care you can. And that's great that you're doing that, and you can still continue to do that. But we need to find kind of a better way to do that, where you're not, you know, upsetting people in the office and getting kicked out of, you know, all these different practices. So I've had to do some education around that too.
Yeah. How many times have you been misfired, shooting the messenger? How many times has that happened? You know, they're upset with somebody else or mad at the situation, and, you know.
Yeah, that happens frequently as a social worker. I think, you know, we're kind of the messenger for things. And so sometimes that can happen. But I think, you know, it's hard. Like, it's hard with anybody for that to happen. But I think sometimes you just have to kind of take a deep breath and realize that like that's what, you know, working with people is, and that it's really not about you. It's about frustration with the system. And, you know, how can you make things better for them? And you just kind of have to put your personal feelings aside. I know I've had to do that a lot in my social work career.
Yeah, it's tough. So another one is counseling those in a crisis or experiencing distress, which, you know, you kind of have gone over already. So where I was gonna go with it was, so yesterday I had a grief and trauma, a LCSW who practices in grief, loss, and trauma. So if they're at the clinic, no, let me reword that. How many experiences have you had so far in your clinic of having to deal with counseling someone who is in a crisis or distress?
I mean, a lot of the time, like a lot of our clients, we're a clinic that takes like low income patients and, Medicaid patients. And so we have a lot of patients that will come in stressful situations, like they're getting ready to lose their housing, or, you know, they don't have enough food, or they don't have enough proper insurance, and, you know, trying to find them grants for insurance, and, appropriate housing that isn't hotels, has been difficult. And housing is the one thing I think I get the most of. And that's the one thing I feel like that's the hardest to do, because, you know, we have things like Section 8 housing and stuff, but those lists are, you know, years long. And so trying to find someone some kind of immediate housing that isn't, you know, a shelter is difficult.
Yeah. And that's what I was gonna say too. Like, what does it look like? What does the distress look like? So yeah, the housing and the insurance payments for sure. What would be the next big distressor that you've seen? Like, you know, if you were to order them, what would be next?
I mean, definitely just money. Like poverty is a big thing with our clients, like just not having, you know, the means to either, you know, to buy a car, because Kansas City is not a public transportation friendly city. It's just not. And so, I mean, we do have some buses and stuff, but it's a convoluted, complicated system getting from one place to the other, especially if you're on the other side of the state line. Because, you know, Kansas City, Missouri is right on the state line. And so if you're on the Kansas side, it becomes a lot more difficult. And so like just not having the money to buy a car, or just to have food, or, you know, just basically living paycheck to paycheck, and then having some kind of an emergency, like you own a house and your stove breaks or something, or, you know, not having the income to have, you know, proper housing, having like slumlord type situations where they don't fix anything, and, you know, you're without a stove, or, you know, an oven, and sometimes without like water and stuff. So I think that's a big stressor too. I think like and a lot of that, like money, housing, and insurance and things like that all boil down to just a person's income level.
Yeah. And so since you've been there for a year, then you were in the thick of COVID.
Yes. In fact, I actually worked from home for most of the year. It's kind of a crazy story. I started in March, and I went in the first day for my orientation that was supposed to be 3 days long. It ended up being about an hour. And we found out at 1 p.m. that we were all going work from home the next day. So I've spent most of my year at this clinic basically working from home and doing things over the telephone, which is, I mean, not only difficult in general, but just very difficult when you just started a new job.
Yes.
So I did go back for a bit. Around July, I went back, and they were doing like an A and B schedule. So I went back every other week from July to about Thanksgiving, when I was doing the pediatric work. And then just recently, about 3 weeks ago, I went back full time. So it's been nice to be back. It was definitely an adjustment after, basically working from home for an entire year.
Yeah.
But it's been so nice to be able to see patients and in person and to be around coworkers. It's so nice to be able to like bounce things off other people, when you're having a problem. So it's been really nice to be back, and I've really been happy to be back at the clinic.
I bet. And how many medical social workers are at the clinic where you are?
So there's me. I'm really the only general medicine social worker. We have community health workers, and there's, I think, about probably 8 to 10 community health workers, because we have different locations. We have different locations around the city. And then we have some behavioral health, like that actually do therapy. I'm not trained to do therapy, so I don't do therapy, but we do have therapists we can refer clients to for therapy. So we have, I think, a few therapists at each location.
Okay, that's cool. The challenges that medical social work, well, keep just going medical social workers, but general medicine. What are the challenges that you particularly face? One, we already know, with the whole working from home, that definitely was one. What are some others?
I think the biggest thing, and I think this is kind of true with any social work, is just lack of resources. All these clients that need assistance, like there's only so much assistance out there. And especially towards the end of the year, like a lot of the programs, will get funding in January for the whole year. And then when it runs out, it runs out. And so when you have clients, especially like in the winter months and around like Christmas and stuff, it's really hard to find resources because all the money will have been used up.
Yeah. How much have you, do a certain amount of money is allotted, for like medical, and then how much for the clinic or whatever. How much do you think, you guys find yourselves actually like short? Like how often, or if ever, have you guys had to come out of your pockets?
Well, so I haven't actually had to do anything out of pocket. I was more talking about outside resources. Mm-hmm. Our clinic does provide like some resources, like bus transportation, bus fare and cab fare when clients need help getting to appointments. And I really, honestly, in the year haven't used that enough, because we were trying to do a lot of telehealth too. Yeah. I will say one of the things I've been doing is we purchased a bunch of hotspots. And so I've been contacting clients to give out hotspots for people who have medical conditions that put them at risk for COVID. And I will go porch drop hotspots, and those hotspots are good for a year. And so like if they don't have internet, that's a way for them to be able to do telehealth.
Okay. You was about to say something?
Oh no, I'm sorry. I was just kind of thinking.
How often would you find yourself maybe partnering? I guess it would really be collaborating with perhaps, let's say, like a school social worker. Does that ever happen?
I did that more when I was doing pediatrics. I definitely, when I was doing the pediatric instead of adult, I definitely had instances where I was contacting schools and trying to get help for kids. Like I had some, like just for example, I had a kid that needed to get tested for dyslexia. And so calling around to the school to try and coordinate dyslexia testing and calling to different hospitals around the area that do those kind of testings, like our children's hospital does that. So I did a lot of collaborating with schools and stuff when I did pediatrics.
Oh, okay. That's cool. When, you know, as a whole, it's kind of hard to build rapport with clients, right? So since they're actually there for some medical reason, how hard or easy has it been for you to build that rapport and get the information that you need from clients?
I mean, that's always I feel like a difficult thing to do. It's definitely felt easier recently now that I've been in the clinic, because just face to face, like it's much more easy, you know, with facial expressions and even like tone of voice, like in person. It's just so helpful to have that. And I felt like that's really been helpful. It really has kind of driven home how important, you know, facial expressions and in-person interactions are. Because when I was doing that over the phone, it's just so difficult to build a relationship with someone over the phone, which is what I was doing during COVID. And that's been really difficult. And I felt like I didn't really have a great relationship with my clients. And now that I'm back in clinic, I felt like I still talk to some clients only over the phone, but there's definitely clients that I meet with in person. And I just feel like that in-person connection has been so helpful and is really kind of at the heart of having rapport with clients.
Yeah. General med and would include a lot of administrative tasks, right?
Yes.
So then go ahead.
Oh, sorry. Yeah, it's a lot of, you know, like calling other center, like I had to call rehabilitation center last week to collaborate, and calling, you know, different places for medical records to get to our clinic. So it's been a lot of collaboration with other people, and especially with the nurses and doctors at our own clinic.
Right. And so that wasn't what I was going to say. Okay, hold on.
Sorry.
I didn't quite lose it. Just trying to get my word in it. Okay. So with the administrative tasks that you have to complete, do you find yourself sometimes feeling like a robot? You know, like it's the same things, or do you find that your day is completely filled up with stuff and you lose track of time?
I would say a little bit of both. Like there are days when the clinic is less busy and I'm making phone calls and for the hot spots, and I feel like that is much more like robot type work where you're just kind of calling the client, oh great, do you want this, you know, asking the same questions and kind of getting almost the same responses. And that's a lot. But it's also like one thing that's at the clinic that I love is that it's kind of a different day every day. Like, you know, Thursday I had a lot of those calls, but then Friday they actually were short on volunteers. So we actually have been able to be a provider for vaccines. So we're actually giving out vaccines to the community who are eligible in the right phase for Missouri. And so I've been able, like Friday, I went to help down in the vaccine clinic because they usually have volunteers that help out along with a few staff. And they were shorthanded. And so I went down and did registration for that at the clinic. So that was really fun, and it's fast paced. And so it's really kind of a different thing every day, which I like. That's one thing I feel like social work is like that in general a lot, is it's kind of a different thing every day. And I really enjoy having that kind of work where, you know, one day it might be kind of that like machine, like, oh, just kind of going through the day. But then the next day, you know, you either have something like that or like everything just explodes and you have a really busy day where like you have 5 crises in the same day and you're trying to work through all the resources. And so I would say like on average, like my day is different every day and I really enjoy it. And it's just something different every day.
Yeah. Do you, like I asked the other social worker, do you listen to podcasts?
I do sometimes. Yeah, I have a few that I listen to.
Have you heard of Zen Parenting? That's by a social worker.
I have not. I'll have to look into that. I am not a parent, so I don't listen to a lot of parenting podcasts in general, but I would love to listen to a social worker's take on parenting.
It's very interesting. It's helpful too.
Yeah.
Well, in February, she and her husband had they just called the whole month, they called it Impuary. That's what her husband wanted to call it. He wanted to call it Impuary. So the whole month was about empathy. And so she also talked, she threw in a little bit about compassion and compassion fatigue and stuff like that. So I'm not gonna go too much into it from her take. But for you, have you found yourself having to tone down your empathy volume?
Yeah, I think especially like when clients are angry, like you want to be really empathetic and like speak a lot. Like that's my natural thing. Oh, like I'm so sorry. Like let's get this. And sometimes when people are angry, like, they don't want to hear that. And you kind of have to change your tone and dial that back and just kind of go for a more like, let's fix this. Like, what can I help you do? Like, what can we do right now? What can you do later? And, take a more like straightforward tone.
Mm-hmm. Yeah. And so you trying to help you prevent burnout. Like that was the whole thing. Have you felt an early onset of burnout?
With this job, I haven't so far. And I think some of that is just due to working from home. I definitely I was feeling that kind of at the end of my work from home, just like all I was doing all day was phone calls, and that just got to be a lot. So I guess I would say that I've had burnout at this job in a different way.
Yeah. And I know like that working from home and all the phone calls, especially when people don't answer the phone, especially like in my case, that's a lot of burnout. Or that I was having an early onset of burnout. It's like I'm placing these phone calls, and these people are not answering their phone. They're not showing up for their appointments. And then if I call their caseworker, they answer the phone. And I don't get paid for not doing a therapy session. I don't get paid for phone calls. I don't get paid for no-shows. So it's like,
that's gotta be stressful.
Yeah, I was like, this is early burnout. Like I can't do this. Not at all.
Mine is a salary position. So, I mean, I was getting paid like no matter what, but it was, I guess I didn't really think about burnout in those terms, but it's true. There was some definite burnout at the end of working from home where, you didn't have people answering the phone, which was frustrating. And even if they did, you just like didn't have that same interaction that you normally have. Like I became a social worker only because I wanted to help people, but because I like being around other people and interacting with other people and having an environment where I was home all day and like not even seeing coworker. And I live alone too. So like, there were days I didn't see anyone all day and, sitting there making phone calls. And then I guess, it's frustrating because you don't have that same level of interaction. And since I hadn't been at the clinic before and had basically started working from home and had never actually been there before, I didn't really know any of the clients or any of the doctors or nurses. And so it was hard to I didn't have a name with a face kind of thing. And so that was difficult because I felt like people weren't answering the phone because it was an unknown number and, nobody answers their phones anymore.
Yeah.
And I was really missing that human interaction. And I mean, I think I realized before I went back that I missed it, but I think it was even more apparent a few weeks ago when I went back, just realizing how much I'd really missed being in an office around other people and like in a actual work setting and being with other people in person. You know,
Yeah.
some people love working from home, and I am definitely not one of those people.
Yeah. How did you get yourself through? Let me write this other one down. How did you get yourself through? What kind of self-care did you do?
So I think like my biggest form of self-care, at least between like a work-life balance, which was hard for me in the beginning because, you know, you're working from home and there's no real separation. You know, you're not driving home from the office and then coming home. So I made a really big effort to make sure that, you know, when my time was up at the end of the day, I had an extra bedroom that I had an office in, and I left my computer in there and I shut the door and I told myself, you know, you can't go in there after this time. And that really helped. And also just, you know, getting out, like in the beginning, I didn't really get out at all. But, you know, after a while when things were calming down just a little bit, you know, I would just go to the drive-through and get a coffee, or, you know, even in the beginning when you really couldn't go anywhere and everything was closed, just going and taking like a little drive, like making sure, you know, my car wasn't sitting in the garage for extended periods. So, you know, I just take like my lunch hour and go, you know, take a little drive around a few blocks, and, you know, you didn't go anywhere, but it was just nice to get out, especially in the summer.
Yeah. I wonder how many people actually did that. I wonder, right? Because everyone talked about how clean it got and how the animals came out and all that. I wonder at one point did people say, I don't have anywhere to go, but I'm getting in this car and I'm going to just, you know, go 4 or 5 blocks and come back.
Yeah, like part of that was me. I have a little bit of an older car, and so I was like, I don't really want to leave this car sitting here, you know, for weeks. And so I would get out a little bit and just kind of drive it a few blocks around and come back. And, you know, I have a house, so I have a patio. So that was another thing. Like when it got warm, I would go outside and just like sit on the patio for lunch and just kind of take a break outside.
Yeah.
I think also it was important for me, like I had a pod of people, like a few, like 2 friends that I was seeing during everything inside, you know, without masks on. And we all were like very conscious about what we were doing and who we were seeing. You know, we've been friends since we were in high school. And so we have a lot of trust in each other, to be honest, about like what activities we were doing and who else we were seeing. And so I think that helped a lot, just having those few people that I could interact with, because I live alone, and so I didn't have anyone else, you know, in my house.
Yeah, that's why I was wondering, like, what did you do for self-care? Because, you know, some people, you know, they haven't heard the perspective yet from a person who lives alone, but who also had to work from home.
Yeah,
So
and I
those are
did.
some good measures.
Yeah, and I'm trying to think of what else I did. Oh, I did start. We had like a Zoom, which is something I'm actually still keeping up with. 2 of my friends, one that lives in Iowa and one that lives in Minnesota. We would have like a weekly Zoom on Fridays, and we'd all get together and do like a little happy hour and chat, and that was kind of a fun thing to do, and we've kept it up because it's been so nice to, you know, actually talk to them and see them
Yeah.
over the screen. So that was a lot of help too. Always having that kind of thing to look forward to.
Yes, indeed. So I didn't ask you my opening question. So this is a perfect spot. What is your birth order? And listening to all your personality things and what led you, do you fit the stereotype for that birth order, your personality?
I am the firstborn. I have one other sister who's 2.5 years younger than me.
Mm-hmm. And so do you feel like you fit the stereotype for the firstborn?
To an extent. I'm trying to remember what that stereotype is. I'm trying to remind myself of
Yeah, I
that.
used to put it up on the screen, but then I realized how much that slows, how much it adds to my lag. But I do have it saved. Firstborns, what we know already, like independent. Responsible, motivated, conscientious, controlling, cautious, reliable, perfectionist, achiever, leader, and bossy.
I would say a good portion of those describe me. I'm kind of cautious to take risks sometimes, and I'm definitely like, out of my sister and I would say, especially when we're not so much now, but like when we were growing up, I was kind of the responsible one who like didn't get in a lot of trouble. And although, I mean, we both got our share of trouble, but I would say that fits me to a certain extent.
Yeah, I would say. So one of the social work values, right, includes social justice. And so we talked before, you and I privately had a discussion about how you went down the social justice and political active route. If you would share with the people how you did that, your political involvement and why.
Yeah. So in 2019, I ended up actually running for office for city council. There was a lot going on with that. The current city council representative who was up for office was really not willing to listen to people. You know, people would email her and you'd never hear back from her. And I really didn't feel like she represented people very well. And we were at the point where we were trying to get non-discrimination ordinances in our city. And I was really frustrated by all this whole process. And at some point I just decided, well, you know, she's not representing me. I'm just going to run myself, which is the craziest thing I've ever done. And by far, like, I mean, I don't think I thought about anything less, honestly. Like like I said, I'm not really a risk taker. And people are always surprised when they hear that, because they're like, oh, like you ran for office and you did all this stuff. And I'm like, it took so much work though. Like that's not naturally my personality. And so I ran for office, and there was another woman who was also running that I didn't know at the time, but who I had got to know during the campaign. And she and the other woman who was the incumbent ended up going on after the primary. And so then I ended up helping other candidates, like other city council candidates that I'd gotten to know, run for office. And so it was fun. We did like a lot of canvassing. It was before the pandemic, so we were able to, go to events and do canvassing and stuff. But it really was kind of just a crazy, like last minute decision. I was like, I'm fed up with this. I'm just going to do it myself. And like I said, I have never thought about anything less. It was a little bit crazy. I was just like, I'm going to do this. And then I did it. So after I lost the primary, I did go ahead and I was working with just other candidates that I've gotten to know that I'm still really good friends with. And then I met a woman who was running for our Kansas state legislature. And so I was able to work with her campaign as a volunteer coordinator and this past year in 2020. And so it was an interesting, it was, obviously I ran and had my own campaign, but it was the first campaign I'd actually joined. And it was an interesting year to do that because we really weren't doing a lot of in-person door knocking. It was more leaving flyers and stuff. But so I did a lot of volunteer organization through them though. So I went and recruited volunteers, and I managed volunteers who were working. And so we had a list of different precincts we went through, and we were dropping off flyers, and I managed the volunteers and I helped manage those precincts and who took what. And, it just helped out with other things, but it's been an amazing experience. I've really loved doing it. And I would encourage anyone who has that kind of social justice passion to get involved in even if you don't want to get involved in politics per se, just getting involved with organizations that advocate for things that you're passionate about. One organization I'm on the board of is called Equality Kansas, and they work to get LGBTQ legislation passed and to get bills that are harmful for those groups of people not passed. And so that's one thing that I do. So even if, you don't necessarily like have a political party that you're really strongly about or a candidate that you're really strongly about, just getting involved, in an organization that you're really passionate about is so important with social justice.
Yeah. Congratulations on your run.
Well, thank you.
Did you get to see your numbers?
We did. From what I remember, I think the candidate who was the incumbent, I think, got about 50%, and the other woman who ran against the incumbent got about 30, and I think I got about 20.
Oh, wow. Well, 20 is not bad. I would say. I would think that's not bad for the first time.
Yeah, it was, it was my first time running, and to be honest, I hadn't had a lot of political experience before that. I hadn't worked on any campaigns before that or been really politically involved with a party before that.
Yeah.
And so for the first time I was running, I was actually really proud of that number. It's not, it doesn't sound super high, but when you have somebody who's a first time running and has never really ran before, really been involved in politics before, I really felt pretty proud of myself.
Yeah. So did you have a campaign manager and you practice all this public speaking and go on the news? How did all that go?
So my city, I didn't really go on the news. We did have, we have a local newspaper here that's just for a few cities in the area, and that covers a few cities in our metro area. And so they did reach out, and I did an interview just on the telephone through them. And then we had forums for the public that we went to. I had forums, and then different organizations would send you questionnaires to be endorsed and stuff. And so we had that kind of thing. And trying to think, what was the original question you asked? I feel like I got off on a tangent.
Did you have a campaign manager?
Oh, yeah. So
you practice speeches.
So I didn't have an actual formal kind of campaign team. When I decided to run, I reached out to someone who was part of an organization. They'd started a political action committee to help raise money for LGBTQ candidates. And so I actually reached out to him. I saw something about the organization. I'm like, hey, I'm running in the city and I'm doing this. And he helped a lot. He really helped me, especially in the beginning. I'd never done any kind of door knocking and canvassing. And I was honestly pretty terrible in the beginning. But he helped me with a lot of that. And then the woman whose campaign I worked on in the Kansas legislature, she, before I worked on her campaign in 2019, she helped me, she was very helpful with forum questions and, practicing for forums and things like that. And I had some help with looking over stuff for writing, but I never really had, except for a treasurer. One of my friends was my treasurer, and except for her, I never really had a formal organized campaign team, which is something that I think I would do more now. I think I've learned a lot just from not only my own run, but working on other campaigns now. I feel like I look back and I was like, oh my gosh, there's so many things I would do differently and so much that I've learned. But it was a really great experience, and I really don't regret it at all. And in some respects, while I'm sure I would have been happy being on the city council, it's been really amazing just working on other people's campaigns too. That's been something I've been really passionate about and something I really enjoy doing. And so, what, like I said, while I'm sure I would have enjoyed my time on the city council, in some respects, I feel campaigning for other people is really where I found my passion.
Yeah. That sounds about like me too. if I'd have got it, nice, but I would have preferred it to help someone else like that. Yeah, I really don't want to be the one in the front. Yeah, not really. But yeah. So to circle us back around to why you're here, did you have any last minute things you want to say? Any, I don't know, any recruitments or whatever that you want to make for medical social work?
So I just think like if you have a passion for helping people and you enjoy like the medical field. So my dad's actually a doctor, so I had, you know, some knowledge of the medical field before I went into medical social work. But, you know, if you're passionate about helping people and you like those settings, like working in hospitals and stuff, I would encourage you, you know, to look for jobs in that field. I've really enjoyed it. Like it wasn't necessarily something I ever saw myself doing, but I've really enjoyed it this past year.
Yeah. And I thank you for it. Someone's got to do it. Someone's got to do it. So here's my question. If we were having breakfast at your house, what would you be serving us for breakfast? Would it be pancakes or would it be waffles?
Oh, I don't know. That's a tough one. I like both of them. So pancakes are definitely easier. I don't have a waffle maker, so it might be difficult for me to make waffles. But waffles are definitely my favorite over pancakes. I'm definitely a waffle girl.
What? Okay. Okay. Well, look, you're entitled to your opinion.
But your opinion is wrong.
Yes. So I want to thank you again for joining me. I enjoyed myself. I did learn a bit more about medical social work than what I knew. I had one experience with medical social work, and she was giving me resources, making sure that I was able to catch a ride home from the hospital, from the children's hospital to be exact. So, but you gave me more knowledge, and I appreciate it. That's the aim here.
Well, I appreciate you having me on. It was definitely a great experience, and I was excited to do it.
Yes, thank you. Tell the people again where you are, and if people want to find you.
I am in Kansas City. I'm at Casey Care Health Clinic. So I work on the Kansas City, Missouri side and live on the Kansas side in Overland Park, Kansas.
All right. So thank you again for joining me today. And thank our few viewers that we had.
I hope that you enjoyed today's episode. I would like to thank my...
Okay, I'm waiting for this darn thing.
I hope that you enjoyed today's episode. I would like to thank my guests for joining me, or simply thank you for watching the pre-recorded episode. No matter what your birth order is, how you self-identify, and whether you like pancakes or waffles. If this is the first time you're hearing it today, I want you to know that you are loved. You were put here for a purpose that only you can fulfill. Until next time, take care of yourself. Be sure that you like and share the videos, subscribe to the channel, and hit that notifications bell. This is Real Ram out.